So what we're talking about today is the things that I'm commonly seeing in 2023 that patients are requesting. So one of the first trends that I'm seeing, honestly across the board, is patients are tending to ask for a more natural look when it comes to their breast augmentation. So I think a lot of us have this idea of breast augmentation from like Baywatch in the 90s of just this super augmented fake thing. I might have just aged myself, but that's okay. But that's not what people are asking for now. They're saying, you know, I'm this profession or that profession, and I want to be able to go to work and it not be super obvious, but I just kind of want to feel better in myself. So what I'm seeing is frequently a slightly more modest size breast implant to get a result that is kind of more toward natural. Not totally natural, of course, because we want to, you know, be augmented and feel good about that, but not that super fake look that we were maybe seeing years past. The next thing that I am seeing across the board is people are asking for their fat transfers to look also more natural. So I think 10 years ago when the Brazilian butt lift craze started, people just wanted as big a booty as they could possibly get, and nobody is asking for that anymore. They're really asking for a little bit of curvature here, a little bit of roundness there, maybe some pop at the top of the booty so it just looks like they're super fit and been doing their workouts like crazy, but not this really exaggerated look that we saw in years past. And that's not necessarily just to the butt. I'm also seeing that in hip contouring, fat grafting to the breast, really fat grafting anywhere that we do it to provide for a more natural look as opposed to a very plastic or fake look. Another super hot topic that I've been seeing this year is with the widespread use of weight loss medications that are so effective for people, is then them coming to me and asking what can be done about deflation in places in their body, whether it be sagging skin, breasts that's smaller than they want, or even their face looking a little more droopy and tired. So I'm constantly having conversations with folks about their successful weight loss and how to kind of rejuvenate those areas of the body where they feel like they're so happy that they lost the weight, but now what they see in the mirror isn't quite where they want it to be, and what I can do to help them. Okay. Next thing that I see constantly, because we have better things to treat it now, is skin tightening. And what I'm referring to here specifically is skin tightening without major incisions or skin excisions. So the most frequent spots I'll see this are arms, thighs, and tummy. So the most common device that I use at my practice is what's called Body Tight. And what it does is it delivers radio frequency energy underneath the skin to help collagen and elastin tighten to keep skin looking firm and youthful. So it's a very frequent adjunct that I will use when I'm doing liposuction. If we're worried that after the liposuction, all that fat goes away, that the skin's gonna kind of like slide down and just not look firm and young, we'll do the Body Tight along with it to keep that skin tight and looking nice. Now, everybody is not the best candidate for this, so it's really important that we have that conversation and determine whether or not it's right for you. And I'll be very frank with you if it's the right thing, the wrong thing, and what we need to do to get you to the result that you want. The last thing that I'm seeing a lot more frequently is consults from guys coming into the office. The stigma of plastic surgery kind of gone in society, but there's still a lot of bashfulness or shyness for men to come into the office and actually admit there's this thing that I don't like that I think you can help me with. But I'm seeing that barrier broken down more and more. So common things I'll see guys for: liposuction, maybe they feel like they got a little bit of overdevelopment of their chest or the unfortunate man boob. Liposuction for that, or even a small excision, are the most common things that I will specifically see. We're seeing a ton of folks on the med spa side for the injectables like Botox and filler, just to get that refreshed look that maybe our wives and girlfriends had, and we're like, what are you doing? I know it's not just makeup. So those are some of the most common things I see for the guys that are coming in, which is fortunately becoming more and more frequent. All right, if you liked this content and want some more in a slightly longer format, you can check out my recently revamped Facebook page at NTPS Dr. Anderson.